Joining us now on this Sunday here on Matters of the State, Rick Weiland with Dakotans for Health, the group behind getting the Medicaid expansion on the ballot in the first place and then seeing it across the finish line this last November. Rick, it's good to see you.
Good to see you.
So what was your reaction when you first heard the rumblings that there might be a work requirement that would attempted to be attached to this Medicaid expansion?
Seriously? Well, you know, the first thing that crossed my mind was that power corrupts, and absolute power corrupts absolutely. You know, this is not a one-off attempt to try to meddle with what the voters pass. I mean, I've been working ballot measures now almost since 2014 when the minimum wage was put on the ballot, and it passed by the voters, and yet the legislature decided they thought that the voters had been sort of hoodwinked and that they didn't mean for minimum wage to apply to young adults. We had to refer their change. They made a change to exempt young adults from the minimum wage. That was referred, put back on the ballot, and the voters overwhelmingly rejected what the legislature did. And there have been repeated attempts to do the same thing along the way. And this is just another one. It wasn't that long ago we were fighting a primary effort to pass what they called Amendment C, which would have required Medicaid to pass by 60%. That was put on the primary ballot by the legislature, and the voters overwhelmingly rejected the attempts to require a 60% supermajority vote. So I look at this in the same vein. The initiative that the voters passed says that they can't add anything to it, you know, to make it harder for people to qualify, to become eligible, and that's exactly what they're doing. The good news is it'll go to a vote in 2024, and I think the voters will do the same thing they did on Amendment C and said, you know, we live in a state where the motto, Brian, is, you know, under God the people rule.
Right.
And yet, you know, when the people weigh in on measures like Medicaid and minimum wage and anti-corruption and cannabis reform, it seems like the legislature doesn't really embrace our state motto very well. They're always looking for ways to get at undoing what the voters have approved.
But let's play the devil's advocate here for a second. Setting aside the fact that it's sort of baked in that Medicaid expansion shouldn't have any type of exceptions put on it. Let's put that aside for a second. What is the problem, in your estimation, with attaching a work requirement to the Medicaid expansion? Is it the wiggle room that the definition of able-bodied may or may not allow?
Well, that's part of it, but it's also a solution in search of a problem. Most people that become eligible are already working. Sometimes they're working 3 jobs, but they're jobs where their employers aren't providing health insurance, and they make too much money, which is not a lot. There's still most of them living in poverty. We're talking about the working poor of South Dakota. There still isn't the kind of income they need to continue to put a roof over their head, food on the table, and then go out and buy private insurance without any kind of subsidy. It just doesn't work for them, so they take their chances. And then when they get sick, all of us who have private insurance end up paying in increases in premium charges, co-pays, just the cost of health care in general. So here you have a program that every state in South Dakota, or every state in the country, has adopted. No one's walked away from it since they've been participating. We were one of the last holdouts. The legislature wouldn't do it, the leadership in Pierre wouldn't do it, but the voters did. Now they want to add an able-bodied, and to your point, what's that even mean? People are working. You know, there are a group of medical students down in Vermillion who no longer have access to health insurance through their parents' program, which part of the ACA, the Affordable Care Act, was to allow kids to stay on their parents' policies until they were 26. Well, a lot of these medical students are going to school to become doctors, and they don't have health insurance, which is it just seems like, you know, how can that be? And they would be eligible for this expansion of Medicaid for coverage.
I want to circle back around to something you said, and this is an idea that we've talked about on this program before. You said that you've been involved for a while now in the ballot measure process. What does it say to you that so many ballot measures end up being approved by voters, but they're approved by voters because these ideas aren't naturally bubbling up at the State House and Pierre?
Well, they are bubbling up. They just refuse to deal with them.
Right.
okay? I mean, minimum wage had been put on, on the table out in Pierre for years. Legislature wouldn't do anything with it. Anti-corruption, ethics reform, campaign finance reform, a measure that we were deeply involved in 2016, passed. They repealed it with a state of emergency so we couldn't refer it. And so a lot of those things that were basically passed by the voters to deal with things like EB-5 and Gear Up, the scandals and the terrible tragedies that came out of that created a backdrop for some change. Never saw the light of day. And then you fast forward, I mean, here you got now Medicaid, which passed, couldn't get passed in the legislature, but it did pass with 56% of the vote, and now they're trying to goof around with that. They, as I said earlier, they tried to do it before the election even occurred by putting that killer amendment on the primary ballot. And what's interesting, if you look at the numbers, Democrats didn't even have a single primary in South Dakota last June, not one. Had no reason to even turn out and vote except for Amendment C. But even if they had all stayed home, there were a ton of Republican primaries, for governor, for Senate, for the legislature. Republicans turned out, and most of them voted against Amendment C. So that should have been a real shot across the bow to the legislature that keep your hands off the citizen initiative process. This has been something that is rich in South Dakota history. We were the first state in the country to come up with this idea of citizen democracy. And since 1898, 23 other states have followed suit. So we've got something I think is the envy of the country. And yet they keep trying to make it more difficult. There's a bill right now in the legislature that would require that all signatures collected for any kind of constitutional citizen amendment would be required, get this, that it couldn't be more than 5% from each legislative district. So you'd have to get your signatures in 35 legislative districts. You couldn't get 20% of them in Minnehaha or 15% of them in Pennington County. So again, it's another attempt to make it very difficult for the citizens to organize and do things that the legislature refuses to do.
And don't measures like that send a clear idea from the lawmakers in Pierre of send us to Pierre and then leave us alone?
Yeah, absolutely. I mean, I know there are people in the legislature that don't believe in this initiative process. They think that they've been elected and that's their job to legislate. But when they don't do what the voters want, the voters ought to have this outlet. And we've demonstrated time and time again, even as far back as I was thinking about secondhand smoke the other day. That was an initiative that the voters got together on, and we have one of the most progressive secondhand smoke restrictions in the country as a result of it, because you try to do that in the legislature and you're taking on big tobacco. You try to do payday lending reform in the legislature, which was another measure that passed. You're taking on, predatory lenders, big money. But you can bypass that cesspool of special interests, if you will, and go directly to the people. And when you do, I think the legislature should respect that vote and the will of the voters.
I want to take us down this road for a second. Obviously, there are supermajorities, Republican supermajorities, in both chambers of the legislature. What needs to happen to embolden a stronger Democratic Party in the state of South Dakota? There are real problems there right now.
Yeah, I mean, we don't have a two-party system. That's why I say power corrupts, and absolute power corrupts absolutely. It's interesting that South Dakotans will look at these ballot measures differently than they'll look at candidates. And I'm still trying to figure that all out. I mean, some of these things, whether you're talking about a minimum wage or cannabis reform or Medicaid expansion, just all the things that we've talked about in this brief conversation today, haven't been able to get done in Pierre through the legislative process, but have been able to be approved by the voters through the citizen initiative process. Yet, a lot of the folks that get elected, to represent us in Pierre don't support a lot of these issues. Now, I think, there have been attempts to provide a less partisan redistricting process. You know, I know at one time we were involved in a legislative redistricting by commission versus by the legislature in 2018. And at the time, I think South Dakota had one of the most gerrymandered legislative district map in the country. And it's hard for Democrats to get elected when, you know, you're in District A and you start off with a 3,000 vote deficit. So it's really hard to break through. I mean, it's not a fair election when you got that many more voters. And sometimes the gerrymander, you know, they'll carve these out and they'll go from east to west, north to south to create a district that is untenable for a Democrat to get elected in.
Yeah. I want to move here for a second. The idea of you're currently working on a ballot measure for a repeal of the state grocery tax. What prompted you to action on this?
Well, we're one of the few states in the country that still taxes food, number one. Number two, it just seems like it's extremely regressive. You know, we shouldn't be taxing, you know, people that need to eat, to buy groceries to feed their families, you know, in such a regressive way. And you know, and I have to tell you, I was elated when Governor Noem during the campaign came out. We had put our measure in months beforehand, but I was elated when she actually made this, you know, a campaign promise, and after the election said her number one priority to get it done legislatively. Yeah. And we hope that that is the case, that they can do this legislatively. But if they don't, we have this option. I have to tell you, the state's complicated our ability to get this done. And I don't know if you follow, but at one point when we submitted our language, we weren't talking about taking in the ability for local governments to tax food. Right. It was just the state share of 4.5%. The LRC, which is the first stop in the process, you know, basically gave us a fiscal note and language that basically said, yeah, this would not affect the local government municipalities from taxing food. Yeah. But the Attorney General disagreed and basically said it would still impede local governments from doing that. You know, we had an option to sue the state. You know, the LRC and the Attorney General's office couldn't get together on this. We figured that would just draw out this process even longer. So we ended up resubmitting. Yeah. And it's still being decided. I mean, we have a draft explanation now. We're still trying to digest what the Attorney General wrote. It doesn't seem to be clear and concise. Yeah. And so we have our attorneys taking a look at it. But we're supposed to get a final explanation here. I think it's usually, they got a 20-day process now, 10-day for comment and 10-day to incorporate those comments into the final explanation. But it's long overdue. We don't need to be taxing groceries in South Dakota. We just don't. And it would benefit a good share of the population that's struggling every day. And that's what the governor said. And you know, in a state with that kind of political domination, you got a Republican governor, you got 94 Republican legislators out of 105. You'd think that'd be a no-brainer and they'd just get that done. Right,
right. I'm interested, I want to hear your thoughts on this. So this repeal of the grocery tax was talked about this time last year, met legislative resistance, died on the vine. In the waning days of the gubernatorial campaign, the Republican governor then picks this up as an issue and says, I will carry it across the finish line. When that happened, and as we stand here right now, are you at all concerned that was a misnomer? Because she can promise to fight for it and try to push it, but if she hits legislative resistance again and it doesn't pass, she can say, I did my best, guys.
Yeah, I hope she's putting both shoulders into the effort out there and that it wasn't just an empty campaign promise. It seemed to me, you would think, she just got reelected, very strong numbers, that she'd be able to get her caucus, or the Republicans in the legislature to support her on this. I mean, it passed the House, if you recall, last session. It just didn't do well in the Senate. Right. So I mean, there's support for it, and I think if she put both shoulders behind it, maybe we get it done legislatively and not have to take it to the streets with a petition. And the problem they've created for us is that the legislature can change initiated laws pretty easily. They just don't have to implement them if they don't want. Or,
Right.
you know, they can do what they did with minimum wage and said, we're not going to, we're going to let we're taking young adults out of that formula. We had to refer that. But it's harder for them to mess with if the voters approve an amendment to the Constitution.
Mm-hmm.
But the requirement to get a constitutional amendment on the ballot is twice the number of signatures than an initiated law, and half the time. You know, with an initiated law, you can go to May of the election year, the first Tuesday in May, to submit your signatures.
Mm-hmm.
With a constitutional amendment, it's the first Tuesday of this November. So they cut us off at the knees by going back and forth between the LRC and the AG and not giving us a clear explanation.
Yeah.
We had a fiscal note that said one thing, and an attorney general's explanation that said another. So it forced us to go back in, and another 3 months of not collecting signatures. We should have been on the streets back in late November.
Rick Weiland with Dakotans for Health joining us on Matters of the State this Sunday. Rick, thank you for the time.
Thank you.
You bet, and we'll be right back.